Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Steven Newmark, Director of Policy at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Associate Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life.
Well, Happy New Year, Steven.
Happy New Year.
Welcome to the new season of The Health Advocates.
Yeah, so how are you feeling, 2024? Did you take a little break, I hope, and recharge the batteries, as they say?
I took a break. I filled up my content plate. I watched a lot of TV, read some books. It was good.
Anything worth sharing?
Yeah, I really liked that new mini-series, Lessons in Chemistry. It was a book that was turned into a series. I thought it was great.
Oh my God, the world is so stratified. I don't even know what the heck you're talking about.
That one's probably for the girls, but...
Fair enough. I binge watched The Crown. I finished it, and my wife left me on the last season. She said, I'm not in, but I went all the way, and I liked it, and I had fun.
That's good. It's always good to melt your brain a little bit, reset. Now we're ready to dive into 2024 advocacy.
Yeah.
It looks like we'll be active around the states for copay accumulators, some drug pricing review boards. We have a lot of good stuff coming up this year to help protect patients.
And we should start off by saying it's 2024, and that is a big election year. While there are technically primaries in the Democrat and Republican parties, I'd say you won't lose any money in Las Vegas betting on a rematch from 2020. And polls show the one thing that does unite Democrats and Republicans is that they do not want that rematch. But so here we are, hurtling towards an election that the majority of the country doesn't seem to want. But to paraphrase someone, you go to the election booth with the candidates you have, not the candidates you want. Barring something unforeseen, in November, it's going to be Trump versus Biden. We'll talk more about that throughout the year. We should mention that Iowa is hosting the Republican caucus next week, so anything can still happen, though Donald Trump is the heavy favorite. Nikki Haley, the former governor of South Carolina and former ambassador to the UN, is within striking distance, sort of, in New Hampshire, which hosts the first primary in the country. But behind New Hampshire, it's hard to see where Nikki Haley or really any other Republican can gain ground on Trump. So far, the Republicans are basically acting like, well, maybe he'll go to jail before the primary, but that hasn't worked out too well for them and likely won't. So the primary probably will be packed up pretty shortly on the Republican side. And Joe Biden is also technically in a primary, though betting on one of his opponents would be like betting on my son's flag football team to beat the University of Michigan football. You like that? I got in a shot about the national champions. All right, I'm done. Let's get into what else is happening out there in 2024, or at least January of 2024.
Yeah, we have some few news items to start off the year. We're going to talk about the importing of drugs, biosimilars, and this boost in respiratory COVID cases. So let's jump into our first bit of news that Florida can now import a limited set of drugs from Canada.
Yeah, so the FDA has approved Florida Governor Ron DeSantis, by the way, also a candidate in the Republican primary for president, his plan to import a limited set of brand drugs from Canada.
So when you think about, has this happened before? The answer is no. This approval is a really big deal from the FDA. It's like a long time debate in public health whether to import drugs from other countries. And just to dive into the history a little bit, in 2003, Congress passed a law to let wholesalers and pharmacists import Canadian drugs, but only if the FDA approved it as safe. So that's where this comes from. And then in November 2020, the Trump administration published a regulation that allows states to propose plans to import the drugs. And Florida was the first to do so.
So if the state imports these drugs, who's going to be eligible to receive these drugs in Florida?
Yeah, so in Florida, it would be made available to patients at county health departments managed by the State Department of Health, inmates at state correctional facilities, and certain others served by state agencies. And the program would then expand to Medicaid enrollees.
So at least at the outset, the average Florida citizen is not going to be, shall I say, directly affected by this, will not be able to obtain one of these imported drugs.
Yeah, that's right.
And what drugs are we talking about? For how long?
Yeah, there's a list of drugs that includes treatments for HIV, mental health, cancer, things like that. This approval allows Florida to import drugs for 2 years. So I assume, they'll be looking at what impact it's having and decide whether to continue to do so, stop the program, expand the program, etc.
So what are the next steps? What needs to happen for this program to get implemented?
So, yeah, like all things in public health, it doesn't just happen immediately.
It's not just a public health thing, by the way. It's all bureaucracies,
Yes,
all government, all levels.
that is very true. So, Florida has to submit some drug specific information to the FDA. And this just ensures that the medications that are being imported have been tested and comply with FDA standards. So, all good things there, just dotting our I's and crossing our T's. And then the FDA will relabel them consistent with the FDA rules and labeling here in the US.
And there have to be drugs available, right?
Yeah.
I mean, Canada is not stockpiling drugs for American patients, I assume. So there have to be enough drugs available for importation.
Yeah, I think Canada is facing some shortages of its own, so it'll be interesting to see how this plays out, especially because some other states have also submitted plans or are planning to submit plans to import drugs from Canada.
Well, very fascinating. So we'll keep our eye on that and see what happens and see down the road how it might affect prices to consumers. But for now, we'll monitor.
Yeah, and I guess just to wrap that up, we always want to see what the benefit is to the patient and how it's
Hmm.
saving the patient money. So we'll be looking closely. Like we mentioned, it won't be like a widespread thing that impacts most people in the state. But as we get the reports about how this is going, we'll be seeing how the savings go to the patient or not.
Excellent. Excellent. Up next, I see in the news that CVS Caremark is going to be replacing Humira with a biosimilar on their formulary benefit.
So, as we know, last year a bunch of biosimilars came out for Humira. I think there's about 8.
Hmm.
And now CVS Caremark, which is one of the largest pharmacy benefit managers in the US, they announced that they're going to remove Humira from their major national commercial formularies, which would be effective on April 1, and instead offer biosimilars of Humira. So just to clarify there, it's not all plans. There's certain plans that, like Select Choice, I think they mentioned that you'll still have an option. So it's just good to double check what type of plan you have. Maybe call your insurer, call your doctor to see.
Yeah, it's definitely something I wouldn't want to raise a five alarm fire, but certainly something to be concerned about if you're taking Humira and in good health as a result. You never want to be non-medically switched if things are working well. So it's definitely something to be aware of.
So I'm actually one of those people. Plot twist here. It's funny because I've hosted the Breaking Down Biosimilars podcast and I've learned a lot about them in my time at GHLF. And I was thinking,
Yeah,
like, if I got this news a few years ago, it would have been like, what the hell's a biosimilar? What am I going to do? I've
right.
been on Humira for a few years. This is so scary. But when I saw the news, I just proactively emailed my doctor saying, if this happens, is that okay? And she said, yes, like double check your insurance plan, see if we could opt out. Let's look at the options available to us. But ultimately, it's fine. And I think I feel good about it because, I've learned so much about biosimilars. So my advice for patients that are in a similar scenario would be to learn now. They said it's effective April 1. We're recording on January 10. You have some time to learn more about biosimilars and ask your doctor questions so you can feel comfortable if you get switched. And then also just something to note, since the biosimilar is a different manufacturer, like the actual pen might just look different. So don't be nervous that you got the wrong medication.
Yeah. Well, it's interesting. Essentially, what you're saying, it sounds like, is that knowledge is power. The more knowledgeable you are, the more power you have to make the proper decisions, and hopefully the more comfortable you feel with whatever comes your way.
Definitely, definitely, definitely. Especially when it comes to chronic health conditions and the weird terminology. There's a bunch of terms with biosimilars like interchangeable and stuff like that. And it can seem confusing on the surface, but it's actually pretty simple once you start diving in. And we have great resources to help you get there.
Excellent. All right, next big topic. It is winter. We are in the thick of winter, and respiratory virus season is hitting pretty hard.
Yeah, it's 2024. We're still talking about COVID. Sometimes it can feel so like fatigued. And it's like we got COVID, flu, RSV. It's a lot.
It's a lot. That's why I think it's simpler to just say the respiratory virus
Yes.
or the respiratory virus season.
So let's dive in. We're seeing a lot of flu. The CDC data shows a rise in infection after the holidays. 38 states have high or very high levels for respiratory illnesses with fever, cough, other symptoms. So that includes COVID and RSV and flu. CDC says flu has been increasing most dramatically. Flu typically peaks between December and February, And the CDC director, Dr. Mandy Cohen, expects it to peak by the end of this month.
The good news, experts say that the flu shot this year is a good match for the strain that is spreading most in the community.
Yeah, that's always good to hear. We know that it's a guess, but it's an educated guess because it's done based on the Southern Hemisphere and
Right.
predicting patterns. Especially as we see a rise in cases, it's good to know the vaccine's doing its thing to prevent severe illness.
Right. All right. So COVID, flu, COVID. COVID is putting more people in the hospital than the flu, according to CDC data. COVID-19 hospitalizations have increased for 8 consecutive weeks, rising 20% in the most recent week, but so far still remaining lower than this time last year.
Yeah, that's always good to hear. Obviously, it's bad to hear there's hospitalizations and a rise in consecutive weeks, but it's good to see the data shows that not only is it lower than last year, but also the last 3 winters. So it seems like every year with COVID, it's getting a little bit better.
Absolutely. That is good news.
So there is a new subvariant on the block.
Right. I was about to mention that. Yep. JN1.
I can't even keep track of these anymore, if I'm going to be honest.
Well, JN1 is officially a descendant of Omicron, which is what the vaccines were targeted for. And the data shows that the updates in the vaccines do have effective measures against this variant, and the COVID rapid tests that hopefully have hoarded and medical treatments are still effective as well.
Yeah, I was actually seeing some stuff this morning about maybe testing on day 3 of symptoms instead of day 5 about the test. So
All right.
it's always changing. If you're feeling sick, call your doctor, do some Googling, or just test,
And I would just add, cases are rising.
Mm-hmm.
The peak, supposedly we're not at the peak. It's difficult to predict peaks, but some models predict that COVID-19 will peak sometime in mid to late January, closer to late January, like you said. But wastewater levels, which is an early indicator of community transmission, seems to be very, very high for COVID.
Yeah, well, I got my flu shot and updated COVID vaccine earlier this fall, so I hope
Yeah.
I am protected for this peak. I'll probably be laying low a little bit. It's kind of just like throughout the pandemic, throughout COVID, whatever you want to call it. It's like, bringing back some of the measures at times, like avoiding subway at rush hour, bringing the mask back out, maybe
Yeah.
cooking dinner in instead of being at a restaurant, just small changes to reduce the chance of getting it.
Yeah, I'm back fully masked myself, even though I'm also fully vaccinated and feel pretty good. It's interesting. I wear the mask indoors, I would say a lot. I'm not going to put a percentage on it most of the time, but it's not 100%. And, somebody said, well, isn't that a little hypocritical? I'm like, I don't think hypocrisy is the right word for that. It's like when I take taxis in New York City, I don't put on a seatbelt because they often don't have seatbelts in the backseat. But that doesn't mean the next time I get into a car where I'm able to put on a seatbelt, I still put the seatbelt on, if that makes sense. The seatbelt still provides protection. I feel like for the next few weeks, winter, this is where it's approaching the peak, as you said. I've got the vaccines. I've got my own personal health that I try to keep in as strong position as possible. But then it's the mask. It's the N95, KN95 mask that is the frontline protection, I think. So hopefully it helps.
Yeah, hopefully we know the tools and we'll try our best to stay safe.
Right. Let's talk about the final major respiratory illness this season, which is RSV. RSV.
Yeah, RSV activity also, no surprise there, remains elevated in areas of the country, though there have been decreases in some areas recently. So I guess maybe that peak is kind of going down a bit.
Yes, that's true. It seems to be slowing down, which is good. That being said, hospitalizations lag cases. We'll see where we are in probably a few weeks.
And just to share some of our data, we often share our quick poll results on here, which are given to our patient support program. So at the end of last year, we did a poll on the RSV vaccine, but just a reminder that this is only available to a select few groups. So it's people older than 60, infants, and pregnant women. So they were screened out. They weren't in that category. Infants weren't taking this. So this is mostly data on people over 60.
Right.
And they said 41% said that they received the RSV vaccine. So this was like early December. And then we were wondering for the 59% that hadn't gotten the vaccine, why not? 30% said they planned to get it. They just hadn't gotten around to it. 20% said they don't want it. And 18% said their doctor didn't recommend it. Like they didn't have a chance to talk to their doctor yet.
Wow. Interesting findings, to say the least.
Another big concern that kind of sparked us wanting to do this poll was questions about side effects. We got a lot of emails from the community asking what side effects people got from the vaccine. More than half who got the vaccine said they didn't have any side effects. And for those who did get the RSV vaccine, the side effects were kind of the typical ones you expect, like fatigue, muscle or joint pain, headache. Only 6% had a fever. So really just like the expected things from mild side effects.
Yeah, which are usually better than getting the actual virus itself, right?
For sure. Yeah, I would take those side effects any day.
Yeah.
I notice if I just hydrate a ton and actually eat a lot and eat good food the day of vaccines, like the side effects are pretty minimal to me. I don't have any science to back that up, but
I'll remember that. I gotta say, I got the COVID shot. I felt like I got shot in the arm for like a day.
I was swinging my arm around and it was not sore like at all.
Really?
Yeah,
Wow.
You got to keep it moving.
All right, good to know. Good to know. All right, well, on that note, we will close by saying that vaccines are the best protection. So if you haven't been vaccinated with an updated COVID vaccine or gotten a flu shot, it's not too late. There are also new vaccines and monoclonal antibodies to protect against RSV recommended for certain populations, which include old adults, pregnant people, and young children.
Yep, get your vaccine, talk to your doctor about the vaccine and staying safe and what's best for you.
Excellent.
That brings us to the close of our show. Steven, what'd you learn today?
Well, as always, I would find it fascinating to hear about our polls, and it was good to hear about the side effects. Number one, the amount of folks who experienced no side effects to the RSV vaccine, and number two, that the side effects were, as you put it, somewhat normal and certainly less debilitating than getting the actual virus itself.
Yes, and for me, just doing some research from the news to prepare for this episode, I learned more about the drug importation to Florida and kind of the history around there, what we can expect.
Well, we hope that you learned something too. And before we go, we definitely want to encourage everyone to check out all of our podcasts at ghlf.org/listen.
And if you have any questions, comments, episode topics, definitely email us at podcasts@ghlf.org. And thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, please give us a rating, write a review on Apple Podcasts, and definitely hit that subscribe button wherever you listen. It'll help more people like you find us. I'm Zoe Rothblatt.
I'm Steven Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.